Have you ever wondered how people truly cope after experiencing a difficult or traumatic event, and how you might recognize if someone you care about needs extra understanding and support? When a crisis passes, the immediate danger might be over, but the emotional and mental impact often lingers. Behavioral red flags indicating post-crisis stress are changes in a person's typical patterns of thinking, feeling, and acting that deviate significantly from their normal baseline. These changes are signals that someone may be struggling to process their experience and could benefit from support. These behavioral shifts occur because a crisis fundamentally alters a person's sense of safety and control. The brain's natural response to threat, the fight, flight, or freeze mechanism, can remain overactive. This prolonged state of high alert exhausts mental and emotional resources, leading to observable changes. The individual might be unconsciously trying to regain a sense of security, avoid reminders of the event, or simply lack the energy to maintain their usual routines and interactions. Observing these red flags involves being attentive to subtle yet consistent changes. Look for increased irritability or sudden outbursts, as well as a noticeable withdrawal from social activities or loved ones. Changes in sleep patterns, such as difficulty falling asleep or waking up frequently, are common. You might also notice a loss of interest in hobbies or activities they once enjoyed, or an unusual preoccupation with safety and security that wasn't present before the event. Physical symptoms like persistent fatigue, headaches, or digestive issues without a clear medical cause can also be behavioral indicators. It is important to remember that these behaviors are not signs of weakness, but rather natural, though sometimes challenging, reactions to overwhelming circumstances. Understanding this helps you approach the situation with empathy rather than judgment. For example, a person exhibiting hypervigilance, an excessive state of alertness, might seem paranoid but is actually experiencing a heightened threat response. Another might be experiencing emotional numbing, where they appear distant or uncaring, as a way to protect themselves from intense feelings. Ultimately, recognizing these behavioral red flags allows you to offer timely and appropriate support. It is about understanding that recovery from a crisis is a journey, not a single event. By noticing these signals, you can encourage open communication, suggest seeking professional guidance if needed, and most importantly, reassure them that they are not alone in navigating the aftermath.